Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which investigated the changes in thyroid hormone levels in dogs experiencing acute illness and their recovery. This research, conducted by Andrea Corsini and colleagues from the alma mater Studiorum University of Bologna and the University of Parma in Italy, aimed to understand how acute illnesses unrelated to underlying thyroid problems affect the concentrations of total thyroxine, total triiodothyronine, and thyroid-stimulating hormone in dogs, not just during the sickness but also as they recover. It's well established in veterinary medicine that when dogs become acutely or chronically ill for reasons other than thyroid disease, their thyroid hormone levels can fluctuate. This phenomenon is known as nonthyroidal illness syndrome. Think of it as the body prioritizing its response to the primary illness, which can have knock-on effects on other bodily systems, including the endocrine system responsible for thyroid hormone production. Researchers have observed that during these illnesses, dogs can often show low levels of total thyroxine and total triiodothyronine and sometimes altered levels of thyroid-stimulating hormone. These changes can be particularly concerning because they can sometimes mimic the hormone profiles seen in dogs with true thyroid diseases, making accurate diagnosis a challenge. While previous studies have shed light on these hormonal shifts during the acute phase of illness, there has been less information available about what happens to these hormone levels as dogs recover. This lack of understanding prompted the researchers to conduct a longitudinal study, meaning they followed the same group of dogs over time to track these changes. Their goal was to see if and when these hormone levels returned to normal and to identify any patterns that might be important for veterinarians to consider when interpreting thyroid tests in dogs that have recently been ill. They specifically hypothesized that total thyroxine and total triiodothyronine would decrease during acute illness but would then normalize during recovery, while thyroid-stimulating hormone might increase as the dogs got better. To investigate this, the researchers enrolled 19 client-owned dogs that were hospitalized at a veterinary teaching hospital for acute illnesses. These were dogs that suddenly became sick without any prior health issues in the month leading up to their presentation. The researchers made sure to exclude dogs with pre-existing thyroid conditions, those receiving medications known to affect thyroid function, dogs that had undergone recent anesthesia, and those with severe chronic diseases, to ensure that any changes observed were primarily due to the acute illness. At the time of admission, the researchers collected blood samples to measure total thyroxine, total triiodothyronine, and thyroid-stimulating hormone levels. They also assessed the severity of the dog's illness using a scoring system called the Acute Patient Physiologic and Laboratory Evaluation FAST score. Throughout their hospitalization and during the 21 days following their discharge, the researchers continued to collect blood samples at specific time points, at discharge and then 3, 7, 14, and 21 days after going home. This allowed them to track the changes in thyroid hormone concentrations over both the acute phase and the recovery period. To confirm that the dogs had normal thyroid function, they monitored the normalization of total thyroxine levels or performed a thyroid-stimulating hormone stimulation test in dogs with persistently low total thyroxine at the end of the study. The results of this study provided valuable insights into the dynamics of thyroid hormone levels during and after acute illness in dogs. The researchers found that at the time of hospital admission, a significant number of dogs, specifically 18 out of 19, had total triiodothyronine levels below the normal reference range. Total thyroxine was also low in a smaller subset of dogs, 3 out of 19. However, encouragingly, the total thyroxine levels normalized in all dogs early in the recovery phase. Interestingly, even by the end of the 21-day recovery period, a large proportion of dogs, 16 out of 19, still had low total triiodothyronine concentrations. When they looked at thyroid-stimulating hormone levels, the researchers observed that the median concentrations were higher at the final 21-day mark compared to the time of discharge. In fact, 5 of the 19 dogs had thyroid-stimulating hormone levels above the normal range at least at one point during their recovery. Importantly, the researchers noted that none of the dogs in the study showed the combination of low total thyroxine and high thyroid-stimulating hormone at the same time, which is the typical pattern seen in primary hypothyroidism. They also found a correlation between the severity of the illness at admission, as indicated by the Acute Patient Physiologic and Laboratory Evaluation FAST score, and the initial total thyroxine concentration. Dogs with more severe illness tended to have lower total thyroxine levels. However, they did not find any correlation between the illness severity and the levels of total triiodothyronine or thyroid-stimulating hormone at any time point. These findings have several important implications for veterinary practice. The study confirms that acute illness can indeed lead to alterations in thyroid hormone levels in dogs, supporting the concept of nonthyroidal illness syndrome. The rapid normalization of total thyroxine levels in the recovery phase suggests that a low total thyroxine reading during acute illness might not necessarily indicate a true underlying thyroid problem. However, the persistent low total triiodothyronine levels in many dogs even after they appeared to have recovered clinically highlight that the effects of acute illness on thyroid hormone metabolism can be prolonged. The observation of increased thyroid-stimulating hormone levels during the recovery phase in some dogs is also noteworthy. This increase, possibly a compensatory mechanism as the body recovers from the illness, could potentially be misinterpreted as early or subclinical hypothyroidism if not considered in the context of a recent acute illness. The researchers compared their findings with previous studies on nonthyroidal illness syndrome in dogs and humans. The prevalence of low total thyroxine at admission in their study was somewhat lower than reported in some other studies, which they suggest might be because the dogs in their cohort generally had mild to moderate illness compared to studies focusing on more severely ill animals. The more rapid normalization of total thyroxine in their study compared to some experimental studies involving induced illness might reflect differences between naturally occurring diseases and controlled laboratory conditions. The increase in thyroid-stimulating hormone during recovery aligns with some observations in human medicine regarding recovery from severe nonthyroidal illness. The persistent decrease in total triiodothyronine observed in the study is consistent with it being a common and early finding in both humans and dogs with nonthyroidal illness. The researchers also acknowledged some limitations of their study. The fact that most of the included dogs had mild to moderate illnesses means that the findings might not be directly applicable to dogs with more severe or protracted diseases. Additionally, the close proximity of the admission and discharge blood samples in some cases might have limited the ability to detect very early changes in hormone levels. The presence of mild chronic diseases in a small number of dogs could also have potentially influenced the results, although the researchers did not believe this was a major factor. In conclusion, this study provides valuable longitudinal data on thyroid hormone changes in dogs experiencing acute illness and recovery. The findings suggest that while acute illness can interfere with thyroid function tests, particularly total triiodothyronine and thyroid-stimulating hormone, for up to 3 weeks after the initial sickness, a false diagnosis of hypothyroidism based on both total thyroxine and thyroid-stimulating hormone levels is unlikely in cases of mild to moderate acute illness because these two markers did not concurrently indicate hypothyroidism in any of the study dogs. Therefore, the researchers recommend that thyroid testing in dogs should ideally be postponed if there is a recent history of acute illness to avoid potential misinterpretations of the results. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.